If you are going to sit for the RINPAS examination, CIP examination, or even NIMANS examination, then this video is going to help you definitely, because in today's video we are going to talk about the PT called as the psychotherapies. So the previous year papers of RINPAS have shown that they are going to ask from the psychotherapy. CIP as well ask from this psychotherapy, and your EVAS paper also recently, which was shared on the Telegram channel, are asking for the psychotherapies. Basically, they just focus on the behavior therapy slash your psychotherapy, I mean the psychoanalytic therapy, and the client centered therapy, which is the most favorite. These three are the most favorite. But apart from that, there have been numerous questions on DBT by Marshall Idhan as well, and some odd therapies as well. Okay, so in today's video, we are going to see the 11 most important psychotherapies which you need to study if you are going to sit for any of these examinations, and it will help you definitely. Okay, so this video, this complete notes will be available for you on the Telegram channel, which is from our course program. So in today's video, we are going to discuss the 11 most important theories. This video will be pretty crisp, pretty short, because time is very precious. So first of all, when we are going to talk about the psychoanalytic therapy, the key figure will always be our Sigmund Freud, and talks about the events of first 6 years of life as determinants of the later development of personality. Okay, now this is your psychoanalytic therapy, which is the first and the premier one. And now the next one is your Adlerian therapy, proposed by your Alfred Adler, and Rudolf Dreikurs is the one person who has popularized in the US as well. Now the third one is the existential therapy. This they might not ask. Okay, this they might not ask, but you should be well aware about Viktor Frankl, Rollo May, and Irvin Yalom as well, where they have to focus on the meaning side of your life and all those things. Okay, and now talking about the next one is the person-centered therapy. This is very IMP, proposed by Carl Rogers, and the three necessary conditions. Right now, I am going to show you the questions as well, how they have framed for this thing: the congruence, the unconditional positive regard, and the empathy. The three important components are the most easiest question and the most repeated question in your Mphil PYQs. Okay, and her daughter was Natalie Rogers, and she also has done something about these things. Now about Gestalt therapy, the main founders are the Fritz and Laura Perls, and the key figures are the Miriam and Erving Polster from here as well. And these two are those guys. And behavior therapy, this is very important. This Arnold Lazarus, this guy which you are seeing right now in the middle of your screen, has proposed the multimodal model, which includes the integrative approach from the behavior, cognitive, social, everything has been included in the multimodal approach. So if you have studied about this guy, you will know obviously what I am trying to say over here. And BF Skinner, you already know about operant conditioning and all those things. So what is happening in basically in behavior therapy is that we will apply the knowledge or the principles of learning to our therapy, experimentation, and all those things. Apart from that, this is cognitive behavior therapy. This is once again an important part for your MPhil preparation, because Albert Ellis proposed this REBT, and A.T. Beck has given this cognitive therapy, and this guy is very important as well. As you can see on your screen now, first one is the Albert Ellis, and the second one is the or Albert Ellis. This guy is your Aaron T. Beck. Now this is reality therapy. They might ask, but the chances are very vague. William Glacier and Robert Wapolding as well. This is the feminist therapy, the next one, which focuses on the woman and all those things. And this is the Laura Brown. And the postmodern therapy. This is important one, because now we are moving towards the postmodernism, and SFBT, solution focused brief therapy, is given by Insu Kimber and Steve DeShazer. They both married to each other, and Michael White and David Epstein has given the narrative therapy, where you have to narrate about your life and all those things, and social constructionism as well. So what will fall or what will be under the postmodern therapy? First of all, solution focused brief therapy. So in this therapy, this is, as you can see, the name is suggesting, this is the brief one, and it is completely focused on where it is focused on the solution only, not on the problem. Okay, it is completely focused on the solution only, not on the problem. Then narrative therapy by Michael White and David Epstein, and the last one is are these, you can see, this is Kim Insuberg and Steve D. Shazer. This is last one is the family systems therapy, and this girl, this over here, Virginia Satter, is the IMP over here, and this one Chloe Madens as well. Okay, so while preparing for MPhil, you must know about basically about the disorders as well and how to treat them. So this that is why the psychotherapy becomes very IMP. And you can refer to Murray Bowen, Virginia Sector's IMP, and Salvador Minuchin is also the important person, where the complete focus is on where the complete focus is not just on the individual but also to understand and working with the family as well. This is your family systems therapy, and this girl right over here is the Chloe Medanis over here. Okay, and she has talked about what? Talked about the feminist therapy and all those things. Okay, now so these are the very most important psychotherapies, the 11 psychotherapies, just in 26 pages. The overview is given, so you can just download it from the Telegram channel and you can just study right before your examination so that things click on your mind very fast and very rapid, and you don't have to waste any of your time reading unnecessary things. And now if you are sitting for EVAS, this is EVAS 202 for paper. Question number 48, what is the critical feature of Carl Rogers client-centered therapy? Okay, so now you know along with this as well that her daughter Natalie Rogers also talked about something on these lines as well. Okay, now first of all, analyzing unconscious desires. No, this was talked in the very first slide by us, where we have discussed about the psychoanalytic therapy by Sigmund Freud. Okay, so this is never going to be the answer. Therapist providing unconditional positive regard. Yes. What is the answer? This is the answer. Yes, absolutely. This is going to be the answer. Along with that, what should be there? The congruence between the real self and ideal self, as well as the empathy portion as well. These three are the important core conditions in the CCT by Carl Rogers. Implementing strict behavior modifications, no, and using aversive stimuli, also not. These are from the behavior perspective. So C and D will also be eliminated, and you will be knowing all these options if you have prepared thoroughly for these therapy things. Now this question number 99, the process in which therapist expressed his negative feelings towards patient is termed as negative transference, counter transference, positive transference, or negative counter transference. So for this, go to slide number 1 and study in detail about the psychoanalytic therapy, where you study about free association, transference, counter transference, and all these things. And what should be the correct answer over here? Make sure that you comment down below after studying. Okay, so it will be more helpful for you that you have also solved one question from your recent examination, the previous examination of your Mphil PYQ. And now the next one, exposure and response prevention procedure is based on behavior therapy principle of, now talking about the third or fifth slide, about the sixth one, the behavior therapy, where we have discussed about the operant conditioning, the observational learning, the Arnold Lazarus and all those things about the behavior therapy. In this, the exposure and response prevention procedure is based on what principle? About counter conditioning. So you have to first of all understand what is counter conditioning. Habituation and extinction. Obviously, reciprocal inhibition is that this is for what? This is your for your systematic desensitization. Okay. So either this exposure and response prevention is has nothing to do with your systematic inhibition, or sorry, systematic desensitization, and that is why reciprocal inhibition is not going to be the answer as well, and not about the graded exposure over here as well. So now what should be the answer? You have now two questions to answer to prepare for the upcoming exam. Make sure that you study about these, study about counter conditioning, see books, study about this, see book, study about this, some extra stuff you need to do, and also you will find this thing in general psychology books as well.